Hi, my name is Teresa Raymeyer, and I'm one of the founding directors of Kudvumisa Foundation. Kudvumisa Foundation is an NGO in Eswatini, and we work in the Lubombo region. In 2008, God started moving us in a different direction. We've been in country since 2005. We wanted to provide HIV care and treatment for the most rural populations, and we started in Mapiveni because that was a place that we saw there were the most sick people. So we thought we were going to start with the children, which was what we tried to do, but we ended up seeing that you can't just treat the children without treating the adults that take care of them. Otherwise, there's more orphans.
It was to give people an opportunity who were very marginalized communities, very isolated communities, impoverished, they get little or no care from government, to give them a reason to praise. We decided to move from HIV care into whole health, and that was sort of the transition to where the clinic was started up and opened to provide access to whole health care, not just HIV any longer.
My name is Joel Mashinga. My day-to-day life includes consultation, general medicine, but we have a couple of pregnant women that benefit from our services. So my audience is mostly pregnant people, old people, young ones, and a couple of babies. I had a couple of them as well.
The next big step or dream for us is to do a surgical theater and a maternity ward. And then in conjunction with that, for us to have that here, that also means we would have to have staff housing on site so that nurses would be available 24 hours a day, on the staff rotations even, so that they would be available for women who are giving birth in the middle of the night. To do the maternity ward, we have to have the on-site staff housing.
And for our community, they start laboring at night. So it means you have to have someone to take you to the good supper. So they know if I have to wait. I know they will not turn me back if I go to the tennis. Unfortunately for us, we don't have all the required equipment. So we find that we don't have those things. But at the end of the day, you feel like, oh, I've done a great job. I have said, if I deliver the baby and I still take you to the checkup, you still have to pay. And we still have to organize money for transport to come back home. So if we can have a maternity ward, I think that is the best thing I would have done for this community.
Since 2021, we have not had any U.S. government grants. God has provided miraculously through people, through organizations, through Rotary, through churches, that we now are able to fund this through those kind and generous donations. Yeah, the burden of this organization gets heavy sometimes, but we are learning to lean on Him. And there is something that God has been showing me, and I've been asking Him about this scripture. The one that says, my yoke is easy and my burden is light. And I've been asking Him, what does that mean, God? Show me what that means, because this feels really heavy and not light at all. And I want to understand what that means. And so I've been researching and what He's been showing me is, it means yoke yourself to me. Let me carry the burden. Let me teach you. Let me lead you. Let me guide you. So that the burden, we're not supposed to bear the burden. He is. And so we are both learning that, this is God's. It's God's from the beginning to the end. And so we are learning to lean on Him.